Hello everyone, my name's Aaron. If you've watched the news in the past few years, you're sure to have seen at least one newscast about the growing opioid epidemic in America. According to an article published in the Journal of the American Medical Association in May of 2017, more than 165,000 people in the United States have died from overdoses related to prescription opioids, and millions more have suffered adverse consequences. This is undeniably a terrible issue plaguing the nation, but how is it being handled? Today I would like to share with you all how we are combating opioid addiction in the United States. By educating ourselves about such addictions, we can start to overcome these trials as a society. As someone who has had several family members suffer with addictions to prescription medications, I can assure you it is a difficult process and it requires understanding, patience, and support. The solution to this epidemic can be summed up into two main topics. One, preventing the development of opioid addiction, and two, helping current opioid addicts break their addiction and stay clean. Let's get started. The first step in overcoming any issue is to prevent it from progressing. In an article published January 2012 by David Holmes, a researcher of drug addiction treatment, he said that as abuse of prescription drugs increase, preventing and treating these illnesses is of equal importance. Well, one way we are preventing patients from developing an addiction is by reducing their exposure to the drug in the first place. Our doctors have been reversing a trend of increasing prescription rates of opioids. According to the CDC's annual surveillance of drug-related risks and outcome, overall opioid prescription rates have been decreasing annually since 2012 by 4.9%. So fewer people are being prescribed opioids, and those who are receiving lower dosages for shorter periods of time. Decreases in availability and quantity like this has been shown to have a significant impact in opioid abuse rates. Last year, the Veterans Affairs reported half the number of prescription opioid overdoses after reducing the number of veterans dispensed prescription opioids each quarter by 25%. This indicates that more selective prescription of the medication can have a huge impact on opioid abuse rates. Now that I've discussed some efforts taken to help prevent opioid addiction, let's move on to the next topic: breaking addiction for those who are already addicted to opioids. Breaking any addiction isn't easy, but there are ways to make it easier. According to the National Institute on Drug Abuse, there are medications available that help reduce the symptoms of withdrawal and cravings. For opioid users, the two main medications are methadone and buprenorphine. These medications were so effective in their treatment of opioid addiction, they were added to the World Health Organization's model list of essential medicines in 2005. Those suffering with opioid addiction may also seek outpatient treatment, which can be a support group or one-on-one counseling with a qualified health person, or inpatient treatment, which is basically voluntary confinement, where patients are kept in an atmosphere surrounded by healthcare professionals who provide support during their stay. And this can last for several weeks to several months. The NIDA also recommends comprehensive programs which target every aspect of a patient's life, from medical to vocational and even legal needs, so the patient has all the support he or she needs so they can focus on the task at hand. Now that I've finished sharing with you all some of the ways and some of the resources available to stop opioid abuse, let's start to wrap things up. In conclusion, we have touched on the opioid addiction epidemic, which has taken center stage in our country. More specifically, we talked about measures being taken to prevent it and how opioid addiction is being treated. I know many of us have preconceptions about drug abusers, but if we educate ourselves and try to be a little bit more understanding of their situation, maybe they can find the strength and support they need to seek treatment. Thank you.